Erectile dysfunction. It's more common than you think, but talking about it, that's another story. Many men avoid seeking treatment due to stigma, inconvenience, or honestly, just not knowing where to start. In this HIMS erectile dysfunction review, I'll be breaking down what causes ED, how treatments like Sildenafil and Tadalafil work, and whether HIMS telehealth service is a safe and effective option. Let's get on with it. Many people think erectile dysfunction is just a part of getting older, but that's not entirely true. While age can be a factor, ED is often linked to other underlying causes, and identifying them is key to finding the right treatment. First, it's psychological factors. Stress, anxiety, depression, and performance pressure can interfere with arousal and make it difficult to maintain an erection. Then there's underlying medical conditions. Chronic health issues like diabetes, high blood pressure, and hormonal imbalances can affect blood flow and nerve function, leading to ED. And let's not forget lifestyle habits. Smoking, excessive alcohol consumption, and lack of physical activity can all contribute to poor blood circulation, making erections harder to achieve. Finally, medications. Certain drugs, especially like some antidepressants and blood pressure medications, list ED as a possible side effect. So the key takeaway here, ED isn't always a standalone issue. Understanding the cause is important because medications may not be the only or even the best solution to fight it. Now, if you have no idea where to start, HIMS offers a telehealth service where licensed professionals can determine if ED treatment is right for you, all from the privacy of your home. No waiting rooms, no pharmacy lines, just a discreet, convenient way to access treatment. If you're interested, check out the link in the description to learn more or scan the QR code you see on screen. And stay tuned because in just a moment, I'll dissect exactly how HIMS works and what you need to know before getting started. Now, let's talk about how ED medications actually work and what you need to know before taking them. The most common FDA-approved ED medications belong to a class called PDE5 inhibitors. These include Sildenafil, Tadalafil, Sildenafil, and Sildenafil. These medications work by relaxing blood vessels and increasing blood flow to the penis, making it easier to achieve and maintain an erection when sexually aroused. HIMS mainly offers Sildenafil, Tadalafil, and Sildenafil, all of which are proven to be effective for most men. But it's important to note, these medications do not increase your libido. Sexual stimulation is still required. Studies confirm that PDE5 inhibitors work for most men, but results depend on the underlying cause of ED, which is why a medical consultation is essential. Although, like many medications, PDE5 inhibitors come with potential side effects. The most common include headaches, flushing, upset stomach, and nasal congestion. While these side effects are usually mild, there are certain cases where ED medications may not be safe. PDE5 inhibitors can interact with certain medications and supplements, leading to serious health risks. So remember, tell your doctor if you're using alpha blockers, certain antifungal HIV medications, or nitrate medications like nitroglycerin. Combining sildenafil with nitrates can cause a dangerous drop in blood pressure, so it's important to discuss any medications or supplements that you're using with your doctor. Before I move forward, it's important to know, medications used to treat erectile dysfunction may not be suitable for everyone. A licensed healthcare provider can help determine the safest and most effective treatment based on your individual health needs. That's where HIMS comes in, a telehealth platform designed to provide discreet, doctor-approved ED treatment without requiring an in-person visit. Here's how it works. The process starts with a simple online questionnaire where you'll answer a few questions about your health history, symptoms, and treatment goals. At the end of the questionnaire, you'll see treatment options tailored to your answers, along with detailed safety information, side effects, and usage guidelines. Next, a licensed healthcare provider who is certified in your state will evaluate your responses and determine whether ED treatment and what kind is appropriate for you. If needed, they may ask follow-up questions and do additional tests to ensure that the recommended medication is safe and effective based off of your health profile. If prescribed, your ED medication is filled by a certified US-based pharmacy and shipped directly to your door in a private, discreet package so only you know what's inside. So why do men choose HIMS for ED treatment? Simple. It's private, it's convenient, and it eliminates the hassle of in-person doctor visits. If this sounds like a convenient solution for you, check out the link in the description below or scan the QR code on your screen to learn more about HIMS ED treatment options. Now, while HIMS offers a convenient way to access ED treatment, there are a few things you should keep in mind before getting started. Firstly, compounded medications are not FDA approved. Some HIMS products like hard mints or combination treatments fall into this category. While they are formulated by licensed pharmacies, the FDA does not verify their safety or effectiveness. Secondly, there's no insurance coverage. HIMS operates on a direct-to-consumer model, which means you'll be paying out of pocket for treatment. And finally, HIMS ED may not be suitable for men with certain medical conditions. If you have severe heart disease, uncontrolled high blood pressure, or take nitrate medications, an in-person consultation with a doctor may be necessary before starting ED treatment. So, is HIMS a good option for ED treatment? For many men, the answer is yes. Therefore, if you're looking for a private, convenient way to access ED medication, HIMS provides a doctor-backed telehealth service without the hassle of in-person visits. Secondly, it's great for those comfortable with online consultations and who want a discreet, reliable treatment process. However, keep in mind that compounded medications like hard mints are not FDA approved, meaning they lack the same safety regulations as standard prescription options. If you have complex medical conditions or take certain medications, an in-person doctor visit may be the better approach. If you're interested in exploring HIMS ED treatment options, check out the link in the description below or scan the QR code on your screen to learn more. Thanks for watching. If you found this helpful, check out our other science-backed health videos on the Health News channel. And don't forget to like and subscribe for more expert insights.